So today's talk, I was going to take it like this. I mean, a little bit about what is the menopause. We've heard a lot about it, but from the topic that I'm going to speak on, hormonal changes and its connection with the neurochemicals and other things that's going on in the brain. So physical and mental health at the menopause in the short term, and then of course also the long term, and how can we have a wellness program, particularly in relation to the health of the mind and cognition after the menopause. Next slide, please. So next slide. So first thing I want to say is menopause is natural, inevitable, part of women's life, and sometimes for some women can be actually quite liberating. They don't have the nuisance anymore of the month, and they can go to the temples they want. They can plan all kinds of social activities, so many things, and no fear of pregnancy with the sexual life. So it's quite liberating for many women. But the menopausal symptoms, they can be quite variable, transient, but for most people, mostly mild. Next slide, please. And unfortunately, the menopause is also what can I say, the butt of so many jokes. And, everything, as you can see from here, it says I'm still hot, but it just comes in flashes. I can relate to that. So things like hot flashes or vaginal symptoms, or sleep difficulties, those can be quite distressing. But what happens at the level of the mind and the memory and the mood, it may not be something that actually women vocalize and actually share with their physician. And so I think we also need to talk more about this with our patients. Next slide, please. So, Pariniapan, take a look at this. Menstruation, menopause, mental breakdown, menaces. Notice how all of women's problems begin with men. Yes, next slide. So, very interesting slide. I show this at most of my menopause talks, which is while the life expectancy of women has increased dramatically, you can see from way back when the age at the menopause has remained fairly constant around 47 to 53, so somewhere in the average age of 50 years. So given the current longevity of women live well into their 80s and 90s. You can see that they are going to spend a good part of their life, some even half their life after the menopause, but most people spend a good one third or more of their life after the menopause. So it becomes very relevant to what we are doing today to discuss the various aspects of life at the menopause and beyond the menopause. Next slide, please. So this we have heard very elegant talks on this as well. Progressive, it's an endocrinologic continuum that takes reproductive age women from regular, cyclical, predictable menstruation that are typically characteristics of ovulatory cycles to a final menstrual period. And during this time, you see what's happening to the estrogen and therefore also the gonadotropins and how these are linked to other neurochemicals in the brain. Next slide, please. So typically symptoms attributable to menopause, as I mentioned earlier, are vasomotor symptoms, GU symptoms. But what I want to highlight today are sleep disturbances. And then, of course, there's sexual dysfunction, other changes with skin, hair, joint pains. And joint pains may be related also to the sleep disturbance. It's more like connected with that than anything else, like a fibromyalgia. But mood and depression and cognition, there are many estrogen receptors in the brain, and even the perimenopause that I showed you, and the menopause and postmenopausal years, typically from the declining estrogen levels and other changes. And then cognition, the data is mixed. It may be related to sleep, it may be related to vasomotor symptoms. Next slide, please. So just begin with the clinical scenario. It's a patient of mine, 51 years old, high school teacher, last menstrual period 9 months ago, has been forgetting names of old students and colleagues. Long history of migraine, very stable and migraine free for years. Recently, more frequent migraines, especially at work. Very embarrassed and upset about that. She's been sleeping poorly with frequent waking up and trouble falling asleep again. Her menstrual cycles have been erratic. So we said last period was 9 months ago. She met me also once when it was about 4 months ago. She feels stressed and wonders if it is all downhill from here. Is this how my life is going to be? Am I going to forget names and am I going to forget people and am I going to have sleep difficulties? So she was deeply disturbed because, as it was said, you're supposed to be fabulous at 50 and she's feeling all these terrible things. Next slide, please. So, what are the things that are influencing cognitive impairment in peri and postmenopausal women? With the estrogen decline, there is sleep deficit, there may be actual depression and hot flashes, and they in turn can affect our cognitive functioning or produce cognitive impairment. Next slide, please. So, 62% of women in a Seattle midlife women's health study reported noticeable decline in cognitive performance following the menopause. The most common complaints were difficulty recalling words or numbers, needing memory aids, and forgetting why one was involved in a certain behavior. So, this was a very important study. Next slide. In a study that utilized a sample of faculty members, female faculty members between the ages of 30 and 60, who worked for a large New York school, they found that the peri and postmenopausal women were over 3 times more likely to report memory complaints than the premenopausal women. So it's not just workload or being preoccupied or too many things, it's actually related to the peri and postmenopause. Next slide, please. Then, so naturally we think if it's because of estrogen decline, why don't I put it back in and everything should get, cancelled out and things should become all right. So unfortunately, Henderson and Sherwin, they conducted an excellent systematic review, examined evidence for treatment utilizing hormone therapy from 20 well-designed research trials. And then what they found was, I mean, they ruled out confounding factors and then did also objective measure of verbal and non-verbal episodic. They found it was not effective in enhancing cognitive performance in 9 of these studies, all of which included samples of mostly older women. So replicated in other 9 studies where it was middle-aged women also. Next slide, please. So it's not just a function of estrogen decline, and as you can see here, no major changes in cognitive function. Next slide, please. This is from the Nurses' Health Study. Next slide, please. Yeah. So, what about risk of actual dementia with combined estrogen progestin therapy versus placebo? Unfortunately, again, as you can see in the Women's Health Initiative memory study, after a mean follow-up of 4 years, it was associated with an increased risk of dementia. So, again, this is not one of the indications for hormone replacement therapy. Next slide. Now, coming to sleep issues, prevalence of hot flashes correlates with prevalence of insomnia, and menopausal women spend significantly longer times awake at night and have lower sleep efficiency, as you can see from this particular slide. Next slide. And all of these are relevant, and I'll come to that when we tie all of these things together. Next slide, please. So, in summary, from just this portion of the talk, menopause may be associated with changes in memory and sleep. Sleep disturbances may increase migraine, seizure, and fibromyalgia frequency, and sleep aids or hormone therapy may be tried for the short term, but then I just already showed you what hormone therapy does for overall cognitive function, has not been helped by hormone therapy. Next slide, please. Now, what else happens during menopause? We know body composition changes happen, an average weight gain of around 5 pounds, an increased central fat distribution, and also associated with the metabolic syndrome and sleep deprivation is associated with this. A decrease in muscle mass and sarcopenia as well. Next slide. Why did I mention that in when we are talking about mind, mood, and memory? Obesity shrinks the brain. It is associated with reduced brain volume, slows cognitive function, and brains of overweight and obese individuals appeared 8 and 6 years older, respectively. So, aging of the brain happens and shrinking of the brain happens. Next slide, please. So, when the weight goes up, it doesn't mean the viscera go up. The power of, so what happens when we go through the menopause? So the power of purpose goes up, power of judgment goes up, power of contentment, and power of lived experiences. All of that goes up in menopausal women. So I just want to tell Pioneer, I have a different scale. I say, you know, f- fabulous at 40, fearless at 50, supreme at 60, sublime at 70, and enlightened at 80. So next slide. So the power of wisdom, middle-aged brain has developed powerful systems that cut through the intricacies of complex problems to find concrete answers. It calmly manages emotions and information, more nimble, more flexible, even cheerier. So uh, four of six key mental abilities, the peak actually comes in midlife. Very interesting. If it can size up situations better, draw the connections, see the wider context, this enables better judgment, appreciates subtlety and ambivalence. So, in research on wisdom, what it is and who has it, one study concluded it peaks around 65 and a sustained accumulation occurs throughout middle life. So, all is not lost. Next slide, please. So myelin, the crucial white fatty coating of the nerve fibers, makes the connections in the brain work. In two key areas of the brain, myelin continues to increase well into middle age, peaking at 50 on average, often continuing to grow past 60. So this is very important information. Why I say this is if women can keep their brains active and do the many things and work on mindfulness, actually they can even become more more powerful in so many ways. Next slide, please. So then comes the mind. What is the mind? It is the element or complex of elements in an individual that feels, perceives, thinks, wills, and especially reasoning. So we use mind for a lot of things. We say state of mind, out of our mind, mindful behavior, mind over matter. So it's abstract, but it's very, very real. Next slide, please. So, mind, mood, and the menopause. And I'll show you a few interesting examples. The doctor is prescribing chocolate. I'd love that. Next slide, please. He says you need strong medicine. So, the first thing that happens at menopause is your hormones cannot decide if they're coming or going. So, you either have to laugh it off or you'll end up crying. Next slide, please. So, emotional health is intimately linked to our hormones. The female hormone estrogen and progesterone interact with brain neurotransmitters such as serotonin and GABA. Both of these neurochemicals are implicated in depression, PMS, and anxiety reactions. Next slide, please. Then you toss and turn most nights, which I mentioned to you about sleep disturbance. And what does that do? Next slide, please. So clearly, it also increases prevalence of sleep apnea with menopause. And we know the link between sleep apnea and cardiovascular health. Sleep apnea and type 2 diabetes have significantly higher obstructive sleep apnea compared to premenopausal subjects. Next slide, please. So most women have trouble sleeping in middle life. 61% of menopausal women report insomnia symptoms. Estrogen and progesterone help protect younger women from what we think of as male breathing disorders such as sleep apnea and snoring. But as these hormones wane, women become more susceptible. So we may have to help women by referring them to sleep specialists or addressing these problems. Next slide, please. So less brain volume in patients who have sleep apnea. So if obesity decreases the brain volume, snoring decreases, sleep apnea decreases brain volume, you can see what it can do to cognitive function. Next slide, please. So, effect of hormone therapy on cognition and mood in recently postmenopausal women. This is the KEEPS cognitive and affective study. However, beneficial mood effects with small to medium ESS were noted with 4 years of CEE, but not with 4 years of transdermal estrogen. So the generalizability of these findings is limited to recently postmenopausal women with low cardiovascular risk profile. So Meeta's talk on risk stratification was very, very important. Next slide, please. Then you're finding it harder to get older. This woman says, I'm a victim of identity theft. Menopause took a happy, slim, sexy woman and turned her into me. Next slide. So every day you notice a new wrinkle. You may be gaining weight despite working out harder than ever, and hair may grow on the face. Children may be teenagers and don't want to spend time with you anymore. Your spouse may be going through his own midlife crisis. It may feel like you're suddenly invisible to the opposite sex. And who would have thought you would miss that? Next slide, please. So, and you're taking care of elderly parents. Next slide. So, why this is important is what happens to the mind and the mood is also influenced by all of this and not just by changing estrogen levels. Caring for aging parents can be daunting, making doctor's appointments, doing all the day to day things, and just having caregiver fatigue. They're now responsible for parents while still caring for their children, and they feel pulled in multiple directions. Next slide, please. So the trajectory of vasomotor symptoms, as you can see, what happens is so variable in different people, depending upon early onset or late onset or high risk of it or very low risk of it. Next slide, please. And worse physical symptoms equal to worse cognitive symptoms. Women with more hot flushes experience more cognitive deficits. Intensity of menopause symptoms is associated with more memory and attention complaints for longer durations. Next slide, please. Good correlation. So we need to think of therapies for vasomotor symptoms like cooler rooms and cotton loose clothes, plenty of water, yoga, meditation. Could consider venlafaxine and hormone therapy for some for a short period of time. Next slide, please. Now, coming to the brain, stress shrinks the brain cells in hippocampus, as you can see here. Next slide, please. The menopause, the risk for depression, especially women with previous episodes, is quite enhanced. With estrogen withdrawal theory is estrogen enhances serotonergic and noradrenergic transmission. The domino therapies, somatic symptoms, especially sleep disturbance, anxiety, sexual dysfunction, create a risk for depression as like a downline effect. And then, of course, the life stage perspective, which I already mentioned about parents and husband and children and changing family, or professional roles, interpersonal losses, aging, and physical illness, which is why I mentioned all of that earlier. They contribute to depression. Next slide, please. And of what happens to depression and the brain. The number of days of depression is associated with severity of hippocampal atrophy. And depression is associated with impaired memory, executive function, and processing speed. Next slide, please. So the wellness prescription really after all of this is exercise and eat healthy, find a self-calming skill to practice like yoga, meditation, or rhythmic breathing, avoid tranquilizers and alcohol, engage in a creative outlet that fosters a sense of achievement, stay connected with your family and community, nurture your friendships, practice mindfulness, tailored short-term hormone therapy for those with vasomotor symptoms, premature menopause, or surgical menopause is the way to go. Next slide, please. So there are many risks and benefits of hormone therapy. I just want to show you while we talk about certain things like vasomotor symptoms that are being helped. Overall, for the other things like heart and osteoporosis or cancer prevention or for those kind of things, we have moved away from prescribing hormone therapy. Next slide, please. So now, very quickly, the last few slides on a brain wellness program. You will be amazed at the end of this. Next slide, please. So this is the hippocampus, just to show you what it looks like. Next slide. And the unique integrative approach. Next slide. This is a program in the US where they first do a comprehensive diagnosis to evaluate brain health, which is not a big invasive thing. They just do the basic stuff, and then they make sure that your heart condition is good because it's a lot of physical activity, baseline blood test to look at whether you are diabetic or having lipid disorders or having a thyroid issue. And then they also, of course, do your sleep assessment. Next slide, please. And then what they do is they put you on a healthy eating program. You do the neurobiofeedbacks, and then a lot of physical activity, good diet, and a lot of cognitive skills and memory training. Next slide, please. At the end of this program, next slide, what they found was this absolutely remarkable. Next slide. The hippocampus actually grew in these people. So the hippocampus is capable of growing at any age. So it's really important for us to stress this to our patients and to ourselves that healthy eating, physical activity, practicing mindfulness, engaging in other extracurricular activities that give us joy, and then connecting with friends and family, all of these things actually will improve the brain. Next slide, please. So, in summary, menopause is a natural part of every woman's life with varied presentation from smooth to turbulent. Attention to lifestyle and health conditions should be the approach to long term wellness. Mental health is top priority, and everyone around should listen and not dismiss it as menopausal whining. And Menopause Society, as Jaishree is doing now, and healthcare professionals are the advocates for women throughout her lifespan and especially at the menopause. Next slide. And this International Women's Day, we are launching this program called Please Unmute Yourself, Ladies, where they will be encouraged to talk about the various aspects of mental health, especially mood and memory and cognition and the problems that they are having. On that note, thank you so much, everyone.